Let's cross now to our political correspondent, Katherine Forster, who joins us outside the inquiry. And Katherine, this has been reverberating across every corner of our nation.
Yes, indeed it has. This 2,500-page report by Sir Brian Langstaff, and really it could not be any more damning than it is. He talks of a subtle, pervasive and chilling cover-up, deliberate destruction of relevant documents, and he says that what happened could largely, though not entirely, have been avoided. And I have to report that it should have been. He also said that successive governments and authorities did not put patient safety first. Also, astonishingly, he says that the risks of hepatitis posed by blood transfusions or the use of plasma were known to the NHS prior to the NHS's inception in 1948. And the importation of Factor VIII products should never have been licensed in 1973. So this is decades before this happened. Bear in mind, these are blood products that were given in the 1970s and 1980s, right through to 1991. We knew that warnings had been given by the mid-80s. In fact, Kenneth Clarke, who was Health Secretary at the time, has been singled out for criticism. But now we hear also that, in fact, the product should never have been licensed in the first place, and in fact that some of the risks had been known decades earlier. It really is quite incredible. But meanwhile, an apology will be forthcoming from the Prime Minister, we understand, this afternoon. A compensation scheme will be outlined tomorrow, upwards of £10 billion. But of course, no amount of saying sorry or money can ever undo the terrible wrongs that have been inflicted on thousands of people. One more thing I should just add. Sir Brian Langstaff also says that there'll be many, many more people who have in fact been infected but are not yet aware.
And there are so many people named in this report, Katherine. So many people blamed, not just successive governments, but individuals too. Who? What are the chances, in your view, of any type of criminal conviction?
Well, it wasn't within the remit of the investigation of the inquiry to make recommendations for prosecution, but no doubt the Crown Prosecution Service will be looking at this report very closely, I should imagine. Of course, there will be many, many doctors, many officials, etc., who made decisions, who, as we now know, deliberately covered up or destroyed documents or didn't tell patients about risks that they knew were very real, who have already passed away and so will never be held to account. But there may well be others who are still alive. So I think that's something that is quite possible. It has happened in other countries, but early days yet, although of course this is a scandal that has been half a century in the making.